Welcome to our Facebook Live event. My name is Kristin Meadows and I'm Director of the Individual Market Strategy. We're so happy to have you here tonight, and I'm thrilled to have two people joining me this evening. Johnny Bevan from CJB Financial and Rosalind Contado from our customer service team. I cannot believe it is November 14th already. We want to take this time to provide some important reminders and resources for you over the next 4 weeks, really. It's really down to 4 weeks. So first, whether you are looking for a new plan or you're trying to renew the plan you're on today, 12/15 is the deadline for open enrollment to get January 1st coverage, yes?
Yes.
All right.
Yeah.
So we think that it's a good idea to start reviewing plan options now, so that if you want some extra support, especially with people like Johnny, then you can access that resource right now. And I think as we're thinking about today's date, and sometimes what happens a month from now, like December 14th or 12/14, what are some other things people should keep in mind?
Well, just keep in mind that most people don't like to plan ahead, so it gets really busy those last couple weeks. You had said that there was 4 weeks left until we had open enrollment ended, and we really only have 3 weeks because there's one fake week in there called Thanksgiving.
Oh, good point.
So,
yes.
Nobody's
thinking about health insurance
exactly.
that week.
No,
Okay,
nobody's
that's
thinking about that. So just keep in mind that kind of seems like a week that skips by. But
Good
yeah,
point.
it definitely is. The earlier you do this, the better. We try to keep the process as smooth as possible, but if there ever is a mistake, you want to be able to have enough time to correct that mistake so that you're ready to go with card in hand January 1st.
That's right. And what would you say is one of the busiest weeks for customer service as 12/15 approaches?
The busiest week is definitely going to be the last week of open enrollment, and that's because a lot of customers are scrambling to, get their applications in, or last minute questions that they didn't think of, and a lot of them are just worried about, January 1st. I have family, I want to make sure I'm covered, and so that's definitely our busiest week.
That's right.
Yeah.
So, in addition to resources like Johnny, you can also go to LifeWiseEnroll.com, and we have a whole host of enrollment centers that you can look up to see what's closest to you and get that in-person support if you want. Or you can be directed to resources online to help you with your plan choices, and of course you can always call customer service. One thing we were talking about earlier is that this year the 15th happens to be a Saturday, so good reminder to just, if you have a few minutes right now, start thinking about if the plan that you're on today is the right one, and make sure to stay in mind with those dates. So another thing I'd like to talk about is there's a lot that still remains the same about the Affordable Care Act. We hear a lot in different settings, but one of those things is the subsidy or premium tax credit. So Johnny, can you talk a little bit about that?
Absolutely. One of the first things that we want to touch base when we meet with a client, we want to say, okay, how do we get the care that you need at the most affordable way? Okay, the biggest thing that we can do for that is qualify for a tax credit. You want to take a look, and the big thing that I talk to my clients about is we're not looking at last year's income, we're projecting for 2019. So
Okay.
We want to take a look and see if we can do that, because that could be a huge savings for people.
Indeed, and sometimes circumstances change, so it's
Yeah.
always a good idea to check and see if you qualify for a subsidy. So in addition to thinking about the plan that you're on today, there's some things that our existing customers should consider, and I know that we're already starting to get calls from those customers. What am I supposed to do if I'm trying to renew my coverage? So Rosalind, what kind of questions are you getting right now?
Right now, the number one question that we're getting is there anything as a LifeWise customer that I have to do for 2019? And no, for 2019, our LifeWise customers will auto-renew for 2019. You just want to make sure that you pay your health premium bill by December 31st, so you avoid any lapse in coverage by January 1st.
There we go. You can also go to LifeWiseRenew.com and get information about steps you need to take besides just paying for your coverage for January to keep it activated. Anything to add in that regard? You like to keep it simple.
Yeah, I like to keep it simple. Sorry, it's a complicated enough subject as it.
That's right. So speaking of it being a complicated subject, we know that there are things that customers need to think about when determining what plan is best for them. So what are the questions you ask your clients as they're thinking about the health plan?
Right. No, so what I do when we talk to somebody, first we say if you're going to be eligible for a subsidy, then the next thing we want to do is pick a plan.
Okay.
And what are the two main drivers for a plan is what doctors do you want to be able to see and what prescriptions do you need coverage for. So we want to make sure that we find a plan that will deliver the care that you need. Then after that, we try to decide, okay, between gold, silver, bronze, all that fun stuff, where you fit, right? We say, okay, are you somebody that is, healthy and we're just looking to kind of make sure that we don't lose our house if something horrible happens, or are we somebody that has a health condition that is going to require, we know that we're going to go to the doctor quite a bit, we know we're going to have expensive medications. So those are the questions that kind of end us, at the final destination, whichever plan we end up picking. But that's kind of what we look at.
That makes sense.
Figuring that out. The other thing that we do sometimes, I'm a big proponent of going with a bronze plan if you're healthy, and then we have ancillary products that do come from from LifeWise, and that can help with accidents and hospital recovery and things like that. So my clients are finding that generally we can find a much better value getting a bronze plan if they are healthy, and then insuring against those other risks and making a mosaic that it looks kind of like a gold plan, but not at a gold plan price.
I love that. I love that there are options for customers that they may have not considered in the past that may give them more financial peace of mind overall. Okay, so let's recap. December 15th is the deadline for January 1st coverage. If you are an existing customer, just keep paying your invoice and you'll be renewed automatically. If you do have questions about whether or not LifeWise is the right plan for you, we can have you get access to an enrollment center and work with a broker like Johnny from CJB Financial, or you can go to lifewiseenroll.com, lifewiserenew.com to get some more information. I do want to highlight some things that are specific about the LifeWise plan this year. So we have Sacred Heart in our network for 2019 and currently in 2018.
And that's huge for Spokane.
Yeah,
that is
definitely
huge.
huge.
I know.
I didn't mean
Did
to.
get some
Providence
feedback. No,
back.
you're good.
Yeah. Providence
Providence
back.
back. Yes, that's great. And then I think, like you were saying, Johnny, people are trying to figure out if they can balance the premium with the coverage they need in terms of the doctors they're accessing or what kind of utilization they have. And so one of the great things I like about the plans for this year is we offer 2 free visits covered in full right up front. We also provide access to nurses 24 hours a day, 7 days a week. Via phone line, and then Teledoc Services gives you virtual access to a doctor at a $15 copay on our non-HSA plans. And to close, round out the discussion about LifeWise, we do have access to Fitbit devices and over 9,000 gyms nationally through a service we have with the LifeWise plan. So in Spokane, Sacred Heart, and what you may not know is we're the lowest price bronze plan in this county.
Yeah, which is a big thing because I mean, I'm looking at some of my clients here. It's not an insignificant charge, this monthly charge, and a lot of times if they're healthy, we say pick the cheapest bronze plan, and we're just going to make sure that you don't lose your house because of an accident or something like that. So I think that this is a pretty good fit for a lot of people. Didn't mean to take over there, but I think that that's important.
Yeah, no, you can take over all you want. So what else am I forgetting? Let's see. Let's make sure we covered everything. I think we did. LifeWiseRenew.com if you're an existing member, LifeWiseEnroll.com with the enrollment centers, access to people like Johnny. So happy to help you over the next 4 weeks and beyond. But certainly if you can take action now, in terms of busy, it's the less busy time of the open enrollment period. So any questions? But yeah, we've had this come up in phone calls and inquiries to us. What if I had an HSA plan and Washington Health Plan Finder moved me to a non-HSA plan? So I think the bottom line is there's a methodology that's used when the state exchange is mapping you from one plan to another, but that doesn't mean you have to stay on that plan. It's just something you have to make sure that you're getting what you need. We do have HSA plans with LifeWise, so you can give us a call and we can help you figure that out, or again, you can work with a broker to make sure you keep that HSA access.
Yes, definitely.
Yeah.
And if you do decide you want to keep your HSA plan, you want to make sure you make your changes by December 15th, so it goes into effect January 1st for you.
Good point. Yes. Okay. Any questions? All right. Well, thanks everybody for joining us. December 15th
Yeah.
for the January 1st deadline. Thanks again. Have a wonderful Thanksgiving.
Thank you.
Thanks.